Good afternoon, and thank you all for tuning in on this beautiful sunny afternoon. We are very excited to have you on this very amazing and important conversation. We have an amazing panel of experts that are going to dive deep into the effects of COVID-19 in the Black community, as well as those in poverty. My name is Tiffany Majors. I am the president and CEO of Greater Baltimore Urban League. We are a very active nonprofit agency. We provide advocacy, direct services, support to the unserved and underserved in the Baltimore areas. We are the voice when those who live in Baltimore feel theirs is silent. We have several programs that you may see in front of you. Our programs are for youth and for individuals in our entrepreneurship program. We have a Saturday leadership program, and I would like to give a special shout out to our class of 2020. They are in our college and career readiness program. And as you all know, tomorrow is May 1st, which is signing day for all of our seniors. So I'd like to give a shout out to all of the SLP senior class of 2020, as well as my own amazing son, Dylan, who is scheduled to graduate this year as well. They are such a resilient and special bunch. Our entrepreneurs work with our consultants and become well-informed in their business model, scaling, and sustaining their businesses during these critical times. Now more than ever, our participants are expanding because now more than ever, they need us just as much as we need you all in these very ambiguous times. I would like to now bring on our panel of experts who will discuss this global pandemic and how we are to navigate it best. First, I would like to bring up Dr. Gali Santos, co-chair of Johns Hopkins System Health Equity Steering Committee in the Office of Diversity and Inclusion. He works closely with many of our community partners, as well as Baltimore City school system, in providing great resources and information to support this Baltimore City that he truly loves. Secondly, we have our own Dr. Letitia DeRassa, who has joined Baltimore City government as health commissioner in March of 2019. Dr. DeRassa is the first African-American female to be the health commissioner of Baltimore City. She is Hopkins trained pediatrician, and she believes that equitable care is a basic right, for all. She tirelessly advocates for programs that support overall health and well-being of our Baltimore City residents. Please welcome now Dr. DeRassa. She's coming. Last, I would like to introduce you all to Nick J. Mosby, Maryland State Delegate of the 40th District of Baltimore City. He is our own delegate in our area where our program is located on 512 Orchard Street. He has been a member of the House of Delegates since 2017 and is a member of the Ways and Means Committee as well. Delegate Mosby is very instrumental in presenting and passing many monumental bills this year, as well as past years, to support those with past criminal records, bills supporting our scholar athletes and the public school system, and several more bills that support our city. He is always working and supporting initiatives that will enhance and eliminate inequities in Baltimore City. Thank you all for joining us. You can move to the next slide, and I'll be on here alone. As we discuss COVID-19, we understand that COVID is disproportionate. However, we are aware that COVID is merely exposing what we already are aware of. That being the reality of health and economic disparities in the Black communities and those who are poor. COVID indeed is affecting everyone globally, but its greatest impact is that of the communities in poverty. There is a 2-to-1 ratio across the board on the effects of the Black community. In areas where there is 21% of African-American population, there's a 42% rate of deaths in Blacks. Initially, for many, many weeks, you all are very aware that during this pandemic, as the virus was running inhabited in the US, there was a demographic data that was not being released in who specifically was being affected. This became a time where many Black communities held tight to the rumors and notions that Black people could not catch COVID. Once pro athletes and actresses discussed their positive diagnosis, and government and states were pressured to release demographic data, we then learned that the greatest number came from Black communities and communities of poverty. Now, 2 months later, during this pandemic, we are now battered, a nation battered due to pre-existing health disparities and institutional racism. There are two very big components that must be addressed in the Black community. There are medical and social determinants of health, and our physicians will speak in regards to the medical determinants soon. Yet I'll speak about the social determinants, and particularly in the African-American community. African-American communities serve great inequities in regards to access to healthcare, poverty, living in high density conditions and areas, limited opportunities to economic growth, and all of these factors have a great impact on whether they are able to prevent or manage a chronic disease such as asthma, heart disease, and obesity. Poor areas are receiving less testing. We have the least access to testing, and testing is key. Maryland State as a whole is not testing enough people to treat and track this virus. For a state as large as Maryland and the per capita rate, we are significantly low. The preferred number for positive tests is 10%. If we are testing 10 people and we find that one is positive, that means we're doing a good job. However, Maryland is at 18%. It shows that we are reducing in the area if we are testing more. When you have the above 10%, it means that our testing is inadequate. Most of the states in the United States are now testing between 18 and 19%. Two problems is that we don't have enough testing right now per capita, and secondly, as long as we continue to test less people, this virus will continue to run rampant. Our numbers of testing must become positive. The benchmark for testing is 10% in regards to the World Health Organization. If high percentages return, it's a clear indication that we are not testing enough. Now, Governor Hogan has purchased 500,000 testing kits in the last week, and we are praying that these testing kits will get to the areas of need. Yesterday, the information that you see before you, I have the numbers for you, which were 20,000 confirmed cases. Overnight, that number has grown to 20,849 cases. Can you move to the next slide? Our death rate has increased by 87. Our African-American cases has increased to 7,894, and our white cases have increased to 4,912. Right now, I would like to discuss what this means for African Americans and Blacks in Baltimore who are dealing with this COVID. Let's speak to our experts. First, we will speak to Dr. Gali Santos. If you can bring Dr. Gali Santos on, please. Hi, Dr. Gali Santos. Thank you so much for joining us.
No,
you ready?
Yeah, I'm ready. It's an honor to be here. Thank you so much.
Thank you. Thank you so much for joining. As soon as we sent out the plea, you were willing and able to support us in having this very imperative conversation for our communities. We understand that in the African American community, specifically in Baltimore, we still have a high rate of cases. We also have a high rate of individuals who are not wearing masks and protective gear. I would like to ask you, can you tell us what is COVID-19?
Right, no, so fantastic question. First of all, as Sun Tzu said, get to know your enemy, right? The art of war. So what is COVID-19, right? It is a type of coronavirus. Coronaviruses are very common to the global world, right? We have a variety of them. If you have a kindergartner at home, he or she likely has had a coronavirus. It's usually the cause for the common cold. However, over the last 2 decades, coronaviruses have actually resulted in mild epidemics and now the pandemic. They've mutated because they are called zoonotic viruses, meaning they start in an animal, mutate, and then enter human beings. And that's very important to note because that means our immune system is caught off guard. It has no idea who this virus is, so it tries to adapt to it. So coronaviruses, for the most part, are very common. 3 in the past 2 decades. You had SARS back in 2003. You had the Middle Eastern Respiratory Syndrome coronavirus, MERS, in 2013, and now SARS-CoV-2. So they are capable of common things, but clearly they also are capable of epidemics and now a pandemic.
Is there a cure for coronavirus?
Right, so for coronaviruses overall, there is no cure. The most common ones that cause the common cold, it's usually the cure is whatever your mama said. Go stay home, blankets, stay hydrated, eat and so forth, and just let your body take care of it over a few days. For SARS-CoV-1 in 2003 and MERS in 2013, there were still no cures. There was a lot of tests that occurred in order to see if they could find a good antiviral, right? So any antibiotic works for bacteria, antivirals would work for viruses. But for the most part, because of really great public health initiatives and able to quarantine effectively, those viruses stayed local and died off. Now with SARS-CoV-2, that's resulted in the coronavirus disease for 2019, so hence COVID-19. Right now, there is no cure. The best thing that we can offer if someone gets sick enough that lands in a hospital is supportive care. So if they need oxygen, we'll give them oxygen. If they're dehydrated, we'll give them IV fluids. However, while that is fine, it's not going to make an impact on why we're having a pandemic and asking everyone to quarantine and wear masks. So we are actively working on a cure. The vaccine trials are underway. We are hearing some good news that potentially we may have some results this summer. And we have 152 clinical trials for medications happening around the world, some of them here in Baltimore. So I'm hoping we will have more than just supportive therapy in the near future, especially the vaccine. That will allow us to treat coronavirus, COVID-19, no different than the seasonal flu. We give a shot, for the most part, your immune system looks pretty darn good, and we don't have to lock down the state in order to manage it.
Thank you. Can you give us some insight into how you gain work from working in COVID-19 in intensive care units and the community working to allocate resources that they need?
Yeah, no, so I have this interesting kind of dual role. I'm a physician, I'm a pulmonary and critical care doctor, so literally we are in hot commodity, right? We're lung doctors and we're intensive care unit doctors. But since my intern year at Hopkins Bayview, I never forgot my roots, and I began an initiative called Medicine for the Greater Good, which got physicians in training at Hopkins out into the community. And so because of that, I use both those roles right now to kind of shape how we move forward. First of all, even before this pandemic, I would welcome anyone to walk into any intensive care unit and realize the health disparities that we were talking about, that Tiffany, that you were just mentioning, they are escalated in an ICU. In an intensive care unit, you see disparities culminate in the worst case, right? Uncontrolled diabetes that we see in great deals in minorities, they result in heart attacks to strokes to loss of limbs that are being managed in an intensive care unit. Every day that I would walk in an ICU, you see health disparities at their worst, where they're leading to lives being fought for, if not lost. Now, all this pandemic has done is amplified that. So when I walked into Bayview's COVID-19 ICU and I saw the majority of the unit was young Hispanic Latino men. My heart breaks. I've never seen young Hispanic Latino men in an ICU until just now. If you go to Hopkins Hospital downtown, you'll see a plethora of minorities, African Americans especially. So what that has given me insight is just reaffirms what I've always known about critical care, knowing that we're going to see health disparities at their extreme. And so what that's made me realize is physicians and nurses, we need to shed this conversation of being frontline staff. We're not. We are your last line. We are your last line of defense. If you get COVID-19, you get ill, and you land in a hospital, that means all the public health measures didn't work. And so that's led me to reaffirm my position in the community perspective, to try to engage with the community as much as possible. We hold bi-weekly phone calls, right, Mondays and Fridays, to streamline factual information to trusted community leaders that we've established over the last 9 years of working with the community. And then we hear the community struggles and successes. What does the community need in order to effectively stay quarantined and stay safe, right? To me, it's analogous to managing a patient. If you tell a patient, eat better and exercise, it's going to fall on deaf ears if you tell that to someone from Roland Park versus someone from, say, Highlandtown, where I grew up, right? Those are really general requests that one community can accommodate better than another. So you have to, as our health commissioner said, you have to approach this equitably. So when we say, hey, communities quarantine, I got to understand, well, what's keeping them from effectively doing that? So the insight I have as this dual role as both a physician and an ICU, so from critical care to community care, that's really sharpened my perspective that now more than ever, with this ethical reckoning that is COVID-19's impact disproportionately on minorities, especially African-American communities. For me, it's reaffirmed that we don't just need action, right? We get action, we get a lot of action, a lot of charities and so forth, but we need firm commitments. If we're going to make health disparities a thing of this past, especially with fantastic delegates like Delegate Mosby and our fantastic health commissioner, we need people in place that are going to put forward a commitment moving forward. And honestly, that passion gets reaffirmed because I see it clinically and in the community.
Okay, I just wanted to say I'm sorry, Dr. G. We are having some issues, so I apologize for anyone that may be having some issues. I'm getting some information from our promoter that we are having bandwidth issues, possibly due to the storm. Excuse me, you can hear my dog also barking from the storm as well, so I apologize. Sorry. Dr. G, I'd like to ask you one more question. That's the world of, remote working. So I truly apologize for this storm. And if you all are having bandwidth, you can log out and then come back on. Dr. G, considering the disproportionate number of African Americans testing positive with not having many primary care physicians, how can we best receive access to testing for the COVID virus?
Yeah, no, and this is where I will give you my answer as a medical physician and then plea with the higher authorities that can pull the strings and make it happen, right? When we would hear, if you have symptoms, call your primary care physician, have him or her screen you, and then, they'll send you off for testing. And that screening is appropriate, right? We want to make sure, since we have limited testing, we want to make sure we're going to get people with a high pre-test probability to be identified with the disease. But even that conversation meant, well, that means I need to have a primary care physician, right? So right off the bat, you're going to exclude a large chunk of our population because that isn't something that they have, right? It's access to a primary care physician, while it should be a right now, it's more of, another lever or another level of an access that really only some can afford. So my plea would be, if we want to assure that everyone's getting the right testing, we know what's happening in our population and not just in affluent areas and non-minority areas, and I would say, let's get testing sites into the communities. Let's test the patient population there, meaning they don't have to take a car or public transportation to go. So put it there in that system. That's what I would plead. The more we test, right? You asked me, Tiffany, an amazing question. Do we have a cure? No. All we can do is create public health policies built on mathematical models that culminate out of knowing how much disease is out there. We can only know if we have tests.
Wonderful. Now, we are quarantined at home, and we are also asked to wear protective gears in the mask. Are masks and protective gear accessible to the lower income African American communities? And what does that look like for African American males who already feel as though they have a target on them, and now they are asked to cover their face with possibly a bandana if we do not have masks, and now they become a target for promoting their gang or possibly being, I'll just say targeted out. I'll say targeted. So how do we combat the issue with the lack of protective gear, as well as ensuring that our African American males do not feel threatened when they're trying to protect their health, but now they are being portrayed as maybe someone that may be committing a crime?
So Tiffany, your questions are spot on. First, let me just back it up with a little bit of science of why we're asking for the mask. The devil in the details about SARS-CoV-2, COVID-19, is when we launched our public health campaigns against it, we actually just copy and pasted what we did in 2003 for SARS-CoV-1. The big difference between these two viruses, even though they're genetically almost very similar, is that SARS-CoV-1, like the majority of viruses, you're only contagious if you're symptomatic, right? So if I have my runny nose or my cough, that's when you're contagious. That's it, just like the flu. SARS-CoV-1's the devilish detail is that you're contagious even without symptoms. And you know what? Your incubation period, meaning time of infection to time of symptoms, can be up to 2 weeks, right? So 2 weeks of you walking around not realizing you have it and just spreading it and spreading it. So this is why we've made the change, because we're learning about COVID-19 in real time, to say, no, you only wear a face mask if you're symptomatic, to now everyone should wear it, because you know what? You may have it and not even know it. So great, that's the science backing. Then it brings up two amazing questions, Tiffany. Do we have access to this? And two, what about the stigma, right? Let me answer question two first. I mean, the plea that I always have, and I'm going to follow with a quote that Dr. Fauci said. Dr. Fauci, in the Washington Post, someone asked him, what did you learn during the HIV epidemic? And he said, those in authority requesting the public health policies have to communicate with the community to understand their anxieties and stresses. And what you just said, Tiffany, reaffirms that comment, right? You can't just say wear masks and not understand the cultural ramifications it may have, the stigma that it may confirm and bring forth. And so I sit here, I'm a Baltimore son. I have my own narrative, being a son of immigrants. I have my own narrative, right? And so what I would suggest is, if I try to help out my community, I know who to tap as community leaders to help me with that. So what I would say, Tiffany, to overcome stigma and be culturally sensitive, really now more than ever, we need to tap into our community leaders, those who you can count on to talk to and discuss, this is why we need to, right? I told you the science. Science is very objective, right? Yes, there are external biases that may try to influence it, but for the most part, science is objective. Talk with those community leaders. I promise you that has been one of the most fulfilling outcomes I've ever had. When I worked with Southern Baptist with Dante Hickman, Bishop Dante Hickman now, we talked about how flu vaccinations kept people from missing days of work, and suddenly their community health interest of working aligned with a public health request that was getting flu shots. And so the same thing I would request, to overcome those concerns that you laid out, Tiffany, it reaffirms now more than ever, we've got to work with community leaders, right? And that hopefully isn't just an action now, but it's a commitment moving forward. Going back to your first request of access, I don't have a simple solution. I don't. My heart breaks. I'm struggling even for the hospitals to tell me how much they're running out. So what we've done with local city schools, with fantastic individuals like our Vice President, Alicia Wilson, we've been plugged into city schools just to talk about like how you can make masks. I mean, that's where we're at, right? Since we can't get masks for everyone, we talk about creative ways of turning around t-shirts or pillowcases or scarves and so forth into face masks. That's where we're at. And I promise you, I've made my own homemade face masks as well. So I don't have an immediate solution to say, let's get the factory made ones, but we can come up with clever ways of novel strategies of creating face masks here in Baltimore City. Listen, as a son of the city, the one thing this city does not have a shortage of is talent and grit. So
Absolutely.
we shall rise. And actually, I would think the storm that's going through and the bandwidth issues, that's just a metaphor for this conversation. Right? We will persevere through this. So
Thank you.
Now,
we'll bring you back.
Yes. Oh, okay. No, I was just gonna say, talk to your health officials to talk about how to come up with these clever ideas.
Absolutely. We will bring you back. Thank you so much, Dr. G. Let's move to our health commissioner, Dr. Zaraska.
Hi, Dr. Hi, Tiffany.
Thank you so much for you are a very, very busy woman, and I appreciate you giving us an hour of your time to support us. You're doing amazing, amazing, very difficult job with Baltimore City. So we are very grateful to have you. We're grateful for the amazing work you are doing. Your staff are excited, happy to do their job, and you are out there everywhere doing a great, doing your thing. So I wanted to ask you some questions in regards to this. You have a great background, and you've been working with it. So can you tell us a little bit about yourself?
Sure. So my name is Tiffany Majors. I am a pediatrician. I am a wife. I'm a mom. And as you mentioned, I'm the first African-American female health commissioner for Baltimore City. It's funny, when this pandemic hit, I had been on the job but it was right around my 1 year anniversary, actually. So March 11th, 2019 is when I started. And I remember that March 11th, 2020, how we were preparing for what was a pandemic. So it's been an eventful year.
Wow. Wow. That's definitely a way to come in.
Yes, I agree.
Baltimore.
I'm sorry, say it one more time.
What brought you to Baltimore?
So I actually moved to Baltimore about 9 years ago for my husband's job. Now, I'm originally from Maryland. I grew up between Hyattsville and Bowie, so I'm a native to Maryland. I went to UMBC. I trained at Hopkins, and then we moved here about 9 years ago for his work.
Awesome. Why are we seeing the nation with such disparities in African Americans and other races, and when it comes to this disease?
So, I think I don't want to repeat everything that Dr. G said, but, the why, honestly, and it's what you said too, it really comes back to those social determinants of health. We recognize that health is influenced by factors far beyond just having access to a doctor, right? Health is influenced by where we live, where we work, where we play, and all of those things contribute to our overall health outcomes. So exposure to certain conditions over time can lead to different levels of health risks, as well as health outcomes. And specifically in the minority community, we recognize that there have been long-standing practices that have contributed to us having poor access to care. Residential segregation has made it where we are living in much tighter quarters and therefore can't socially distance. We're living in areas that are considered food deserts at a much higher rate than other races. Therefore, we have to go out. We have to go far to the grocery store. We may not have access to transportation, so we have to take, or to our own car, so we have to take public transportation. African Americans are more likely to work in essential positions and therefore can't stay home under the stay-at-home order. They have to go out and work. And often you might have one person who's the primary breadwinner for their family, so they can't stay home when they're ill. They have to keep working. All of these things are contributing to what we're seeing nationally and certainly here in Baltimore City as well.
As we have now changed or broadened the scope of what we consider essential workers, because now our essential workers has become the cashier at Giant or Walmart. It has been our bus drivers. It's become our individuals that are working in our stores. How are they to remain safe when they have to take public transportation?
Yeah, so I think
because in Baltimore City, there are many routes that have been shut down due to a lot of the bus drivers now contracting.
Yeah, I think you bring up an excellent point, right? That we have people who have to take public transportation to get where we're going. One thing that I will say that transportation did somewhat early on is they did start to have riders board in the back to avoid that initial close contact with the driver. I think locally, again, we've also tried to really enforce the messaging around social distancing so that if you do have to go out, that you're keeping that 6-foot distance. As Dr. G mentioned, with the addition of the face covering, though that isn't necessarily the end all to be all, it certainly does help potentially slow the spread and transmission during a time when the other person you're near may not be showing symptoms. So for those people that have to go out, I would recommend putting all those things in place: the social distancing, the wearing of the cloth face covering to cover your nose and your mouth to keep you and others safe.
What does racism have to do with these case numbers and the disproportionate effects on the African American community?
So, I alluded to some of it when I was talking about some of the social determinants of health, right? We recognize that there have been racial housing practices, redlining, for instance, that have pushed African Americans out to an area where, again, they're isolated from potentially jobs, they're isolated from grocery stores, they're in much closer quarters. So those things have certainly contributed to what we're seeing, and that, again, they can't socially distance. They can't just call their grocery delivery to come to their home. They really do have to go out. Additionally, there's distrust for the medical profession. I think we realize that. So prior to coming into this role, a few years before, I worked in East Baltimore at a federally qualified health center, Baltimore Medical System. And so often, even when we could reach individuals within the community, there was a medical mistrust. It was work to gain their trust so that they understood and recognized that that we were here to help. And so I think we're having to overcome that. I think now with COVID-19, in addition to just general lack of access to care. So all of these things certainly are fueled by racist practices and contributing to what we're seeing.
Wow. There are some African Americans who still feel they are immune to COVID-19, specifically in Baltimore City.
Sure.
You see them on the news. You can see that the crime rate is still pretty high, as well as domestic violence is even higher. But what does your office do to help reach these individuals that believe they are still untouchable?
That's a great point. One of the things we did early on around our messaging was develop focus groups. So focus groups of community members to understand what things our message maybe wasn't covering and who our message might not be reaching. So Dr. G alluded to the use of trusted community leaders to really dispense that message. We've also recently developed a myths and rumors page, and I think that's probably the first myth that we have on the page is that African Americans are not immune to COVID-19. In fact, it's quite the opposite, right? 70% of the cases in the city are in African Americans. 70% of the deaths in the city are in African Americans. So we're trying to put that information out there. We've also gone some non-traditional routes of communicating to those who might not normally be reached. For instance, we have groups that hand out paper flyers talking about social distancing, recognizing not everyone's on social media, not everyone's on the internet and may not get our message in that way. I've done a number of radio interviews, again, that have a focused audience of African Americans in an effort to dispel all of those myths and rumors. Not only are we susceptible, we are having it at much higher rates, and our fatality rates are much higher.
Absolutely. I actually was going to get it, but you got it before I did, in regards to when you said we made a page, because that is one of my ailments that really angers me right now is everything going on to this digital platform. There is a vast digital divide right now where our students are not even receiving education. In other states and other communities, you have students actually right here in Maryland, in Calvert County and Anne Arundel County, where before the schools were shut down, they were actually provided laptops to go home and be educated. Our students are just receiving in Baltimore City their first week of education. Weeks before that, they didn't have digital support. We have Comcast and Verizon that provide months and months of service. However, how are they supposed to receive your service when they don't have the technology that it requires to just get a minimal education? So my question was going to be to you, what about the individuals that don't look at your page, don't go to the health department? I know, like you said, it's about community leaders. And I will give an awesome shout out as well to NAACP, who is doing something very paramount with their bus riding around with information. And it's not just in regards to COVID, but it's in regards to our census and knowing that we must vote. You know, the big deal is COVID, but we also must understand that one reason why it's running rampant is because we need to get out and vote and have a competent person that can make educated decisions with the use of medical providers, not their own what they feel. So I just wanted to ask you, lastly, what can everyday people do to protect their families when they are essential personnel, when they are making still the $8 an hour and still can't provide the meals, when the number one decision that we have to make today is, do we educate the students or do we feed them and their families first? So for the first 4 weeks, we were doing millions of feeding, and then secondly came the education. So how do we protect those most that have the least? I'm sorry.
So I would advocate and say that you got to do both. And you know, the meal distribution program is still very much continuing. I think that the school system is certainly working on ensuring that there's equity. I'm going to let Delegate Mosby delve into Kerwin. I'm going to let him do that. But I do think, honestly, you have to do both. We recognize that, again, so many of us are essential workers. We don't have the option not to work. So the best thing to do is when you do have to go out is really to protect yourself. It is to wear that cloth face covering. It's to wash your hands when you come back in. Always carry hand sanitizer on yourself so you can wash your hands as well. It is, some of the small measures, some of the things that we were talking about early on, those personal protective behaviors, we still want to do those, but they are not necessarily a replacement for social distancing. Again, if, we want to try to minimize the spread, and social distancing really does help to do that.
Have you found that individuals that have pre-existing conditions are the individuals that are really having the worst issues or the death rates because of it? Or are you finding that there are individuals that have a totally healthy background, young, not the elderly, that have contracted this virus and has not always made it out too well?
So, I think the other, myth that happened early on is we focused so much on the vulnerable population and those at high risk that I think young people did start to develop this notion that they weren't susceptible. I want to be very clear, and if you do have internet access and go to our website, coronavirus.baltimorecity.gov, you can see the breakdown of cases in Baltimore City by age as well as race demographics. And it is across all ages. So I want to be very clear that anyone can have it, from children up to older adults. We certainly tend to see more severe disease in older adults and those with underlying chronic conditions like heart disease and diabetes and lung disease, but everyone is susceptible, and we can still see deaths in young people as well. In Baltimore City right now, about close to 30% of our deaths have been in nursing home residents. So again, those that are older and likely have some underlying chronic medical conditions. So certainly there's, again, more severity typically in the disease in those folks. But it's happening in young people. And, I think Dr. G even mentioned seeing young Latino men in the ICU with it. So it is a disease that can impact anyone.
Thank you very much. Thank you for your time. We are now going to bring on Delegate Mosby so we can ask him about Kerwin in this education piece. Thank you. Delegate Mosby, are you here? Hello, sir. How are you? Can you hear us?
I'm doing great. Yep, I'm doing great. How are you doing?
Fine, thank you. Thank you so much for joining us. I wanted to say thank you first for taking out some time to speak with Baltimore residents and everyone who has joined in. And I wanted to ask you, because you were one of the first people that called for Governor Hogan, as well as our city representatives, to release the data in regards to the African-American community. Why do you think that data was so important to release?
Well, when government, be it federal, state, or local, are making decisions, particularly in the midst of a crisis, without data, unfortunately, it's been shown and proven time and time again that Black and Brown communities are kind of overlooked. What I wanted to is expose the data so folks can understand and know, kind of like with what both doctors have said prior to me, about the issues around comorbidity. And we know that health disparities in our communities, be it hypertension, be it cardiovascular issues, be it diabetes, asthma, you name it, are major problems. And we know when you tie it to a cause, a disease like this, that it could have drastic effects. And that's what we've seen throughout the country. So I wanted to ensure that we put the data out there to make folks shine light on the data and ensuring that we have effective and equitable plans around engagement, around testing, and also around treatment. Many people talk about, you've heard a lot of these phrases going around that when America catches a cold, African Americans get pneumonia. And that's what we're seeing right now. And we understand and know that there has been a significant amount of implicit bias as well as baked in discrimination in our healthcare system for a very long time. I mean, look, I'm a product of Tuskegee University, a son of Tuskegee, where the Tuskegee syphilis happened for over syphilis experiment happened for over 30 years. So what I did not want to happen, Tiffany, is at the end of this crisis, in a year or two, someone writes an op-ed or does some research and some white paper to basically show that this was a major issue during this time. I wanted to bring that to light now so that while we're in the midst of the crisis, we can allow the amazing Dr. Letitia to do all that she's been doing for the city of Baltimore and ensure that as we get the absorption of money, that it's absorbed in the communities that have been most impacted by the federal and state government.
Oh, I'm glad you said that, because actually most of the CARES Act money, the first batch of money that came out, the first 400 billion trillion went to actually the airlines and hotels. The first group of PPP loans for small business loans actually went to the largely traded corporations. So it is very clear that trillions of dollars that was supposed to support those in poverty areas are, of course, left out yet again. We see that discrimination and that racism through economic development. We see it through education specifically. You know, now I feel like we're probably yet again out with the Kerwin, and you supported us very much, you as well as Delegate Smith. Can you tell us what can happen and what is the formula to support our students, particularly in Baltimore City, who has really been left completely behind? As I said earlier, there are students throughout this entire state where we have they have their laptops. They were actually offered laptops before they left school. We are now here still trying to get funding so that we can purchase laptops. You have nonprofits, you have corporations that are gathering together funds so that we can have our kids educated. We have students that are trying to take tests on their phones. We have teachers that are unsupported. What can we do during this pandemic to make sure that we continue to educate our students and that that gap is filled throughout the summer? And when our kids go back, we don't have Black and brown children that consistently fall behind, lagging so much more behind now. Even going into college, you have seniors that are 2 months behind.
Yeah, I think you raised a lot of great points around education. I think that the immediate effects of COVID and this crisis will create concerns throughout the board, and education is a major one. I always refer to an example of, say that you maybe have like an 8th grader this year that was on a 6th or 7th grade reading level. That child goes home and now their parents are essential workers and maybe have 2 essential jobs. They do not have, they live in the digital divide. They do not have access to end user devices to participate. And then we expect them, I guess, go back to school next year as a 9th grader. So I know that the school system has been working around the clock of one, identifying our most vulnerable students, particularly our high school students, to get devices in hand. And as you mentioned, there's tons and tons of organization and even individuals that have really stepped forth to ensure that children have access to this. But the biggest point I would like to point out, Tiffany, is the digital divide has been around for 20, 30 years, since the establishment of the internet, right? And I think that in the time of a crisis, those systemic issues that we always known to be there, that we've kind of allowed to be normalized in certain communities, no longer can we kind of turn a blind eye in the midst of a crisis. But as soon as that crisis is kind of coming to an end and normalcy sets back in, those same systemic issues and oppressions are still applied back to those communities. And I think that when we talk about this and around education, again, I think you're pointing in exactly right. We have to talk about the digital divide. So as a city, as a state, as a country, when are we going to get ahead of those particular issues? But again, the school system has been working around the clock. There's a lot of private-public partnerships and a lot of individuals that have stepped up to really make the call. But I think that we are in uncharted territory right here when it comes to education. We know that there is a significant learning gap between jurisdictions, between schools, between neighborhoods in our state and city. And this is going to be another test for us to try to get ahead of.
Thank you. We are going to bring everyone back because we have some question and answers, but I did want to say to you before we bring everyone back, we can bring everyone back, make sure that current is not lost from this pandemic. We need to make sure that our Baltimore City students, all of our students throughout the country, specifically in Maryland, where that formula is so disproportionate, that we are not going to drop the ball on that again. So I'm going to look forward to making sure that you continue to fight for us in that area. Do we have any questions from the audience?
Yes, we have several questions. Everybody is very excited about all the information that's being shared. So for Dr. Rasa, we have a question. We would be remiss not to recognize that you are a graduate of Meharry Medical College. Meharry has historically been at the forefront of care for African Americans, along with Howard, for decades. Ronald Klain, Ebola SARS, sounded the alarm for this virus months before we saw our first signs of infections. Going forward, what methods would you suggest for highly vulnerable African American communities?
All right, I was having some technical difficulties. Can you guys hear me?
Yes.
Okay, perfect. So I missed the last part of what you said. What
Certainly.
methods, and then I lost you.
Going forward, what methods would you suggest for highly vulnerable African American communities?
So, I think everyone's touched on the message somewhat today, right? That we recognize that there are disparities and gaps that exist. I think part of our call to action, everyone on this call, everyone who spoke today, is to be the change that we wish to see, right? So be that change, and make sure that we don't walk away from this pandemic with the same policies, with the same lack of appropriate funding that we had before this, right? That we recognize that this highlighted what a lot of us who work in public health or work in community medicine already know, that there are significant disparities that exist. And it's our responsibility to work together with our policymakers, with our lawmakers, with our community leaders to address those things, right? So how do we ensure that there isn't the digital divide? How do we ensure that there is appropriate access to jobs and job training programs? So, I think that would probably be my biggest takeaway, that we don't leave this pandemic the same way that we came in.
Absolutely.
Excellent. Thank you so much. We have a question for Dr. G specifically. Dr. G, this is from Julie Gaskins. It's one of my favorite pulmonary doctors. Thanks for taking care of my dad. What would you suggest for highly vulnerable patients going into the fall, which is flu season?
Yeah, no. So I would say, first of all, still do the same thing, right? Flu vaccination shots. Make sure you get an annual physical if you can, and if you don't have a primary care physician, please make sure you work with all the appropriate channels to try to establish one. So I would say still some level of the normalcy, flu vaccination shot and so forth. And then stay up to date through whatever means you're getting the most trusted and verified COVID-19 facts, likely right out of Dr. Tish's office at the Baltimore City Health Department, right? Where we're at. I see this because that will still tell us what we need to be doing moving forward, right? So if we're still doing quarantining in some level, we'll need to continue that. If we're still wearing face masks, we'll still need to continue doing that. So make sure you stay up to date with your healthcare professionals. Make sure that you get your annual flu shot. I would still recommend that. The flu will still be there. And then make sure that you have identified a trusted source where you'll get your information. So when the fall does come, right, and it'll come, what are the key things to be doing? Those are the three things I would emphasize. And the point the number one about touching base with your healthcare professional, just to make sure that doctor, he or she can make sure that you are up to date with as best as you can be with your actual health. That way, if you get, unfortunately, the virus, you'll be at tip-top shape in order to hopefully minimize the symptoms and walk away as a survivor. So that would be my recommendations.
Excellent. Thank you so much. Delegate Mosby, this one is for you. I've testified multiple times pre-COVID about the ongoing issues in the school system. COVID has exposed what we've known for decades. Our system is broken and throwing money away, and it will not fix it. We need accountable leadership at the helm. How will you ensure the new funding granted by Secretary DeVos be properly spent by the BCPS?
Well, we know that the legislature put in place an inspector general type of oversight with state school systems. That was done not this past session, but the session prior. We put that in place to ensure that the upcoming Kerwin money and the Kerwin implementation, we were able to get ahead of any roadblocks associated with concerns about that. So with that and continuing to push, I think that there are the necessary safeguards that weren't necessarily in place prior that are in place now to provide full transparency, full accountability as relates to tracking of educational dollars in our state.
Excellent. Thank you so much for your answer. There are a few questions here in the chat in general about how people can engage with their neighbors if they are prone to some of the pre-existing conditions, and what are some low-risk ways that people can contribute to their surrounding community without jeopardizing their own health and safety?
So I think that's a great question. One of the things that I have to say I've been impressed by is the number of people who have wanted to volunteer to help. We have really, I've been overwhelmed personally by people who wanted to donate masks that they sewed, people who wanted to go out and hand out meals. And so, it's our job though to make sure that people are doing it safely. So we have guidelines that we created for volunteers who want to go out. If you're comfortable, if you have your mask, you're able to go out. If you want to, hand out meals through a volunteer program, other services that have been set up, there are actually services where you can call an older adult, and I can make sure I get that information to the Greater Baltimore League. But if you want to do something from the safety of your home, then you can actually call older adults and check on them. I think that's a great way to help your neighbor who may be now experiencing some social isolation as a result of having to be home for weeks on end.
I'm just going to reaffirm what Dr. Tish said. I strongly agree. I mean, right, we said this in the beginning, the best part of Baltimore City is its citizens, right? It's its persons who've lived here. And so I would say volunteering is one of the great things that we often do in the city. So, make sure you check in, just as Dr. Tish said. The only other thing that I would add to that as well is make sure you talk to the people representing you, such as Delegate Mosby, in order to create commitments moving forward. This pandemic will end, but these health disparities will continue if we do not do anything. So you got doctors like us, in the health department, and myself over at Hopkins, but we need the right people also in place to make sure that health disparities are combated in a multidisciplinary manner to make these need to be a thing of the past. So that's what else I would encourage. We're the great politicians that can help us change.
And I would like to double down on that, Tiffany. Dr. G, that's exactly the experience that happened with me when I continuously pushed for the data. I got so many calls, text messages, social media requests from folks in the healthcare profession just saying thank you. Like, we need someone to help us shine light on this. We're working in this environment and we understand and know that this is a major issue and we need elected officials to be on the forefront. And what goes into all, we have a vote that's coming up on June the 2nd. And what I will say is it doesn't stop with just voting for someone, but that's the starting point. It's really important that we do not allow ourselves to come out of this crisis with all that we've known, but more that we've learned, and lose the sympathy and compassion that we've seen around some of these issues. And health disparities, not just in the city, not just in the state, but in our entire country, is really important. And I hope that we continue to run this baton until we are able to incrementally reduce some of the disparities in our country.
I would like to know from Dr. G and Dr. Zarasa, how would someone go about, Greater Baltimore Urban League is very interested in becoming a testing site. We have a huge building. We would like to be inside the community. A lot of the testing sites, individuals have to get on buses, but we are right there in the middle of Martin Luther King Boulevard, Druid Hill and Pennsylvania Avenue, where I am interested in becoming a testing site. We need to increase the testing. Until we increase testing, we're going to continue this. Secondly, I would also like to know, we are looking for possibly a donation for some 3D printers, because we would also like to use our facility to make PPE kits. Pretty much piggybacking off of one of my affiliates of Greater Carolinas. They are able to make PPE kits, 400 kits per day, just from the 3D printers, and they have 2 3D printers. So I'm also looking for donations of 2 3D so we can actually provide some PPE gear to some of our essential care workers. So if either of you
Great.
can assist
Yeah.
me becoming a testing site as well as a site to provide support to the community and making these PPE kits, I would appreciate it.
So two things. I'm glad that you asked because it allows me to talk about our city-supported testing sites. We currently have 3 city-supported testing sites. One is at Pimlico Racetrack, which does require a vehicle. One is at Druid Hill Park, and we have one at Clifton Park as well. Clifton Park and Druid Hill Park do allow for walk-up, so you don't have to have a car to be tested there. However, for all 3 sites, you do have to have a referral and appointment. So, Dr. G mentioned the challenges with access to care. We are also currently developing a mobile testing platform as well, recognizing that we want to be able to go into the community and meet people where they are. We already provide mobile services with our syringe exchange program, with our buprenorphine spot van. So we would be doing something very similarly, where we would be offering testing to people, meeting them where they are in the community. For those who don't have a provider, because we talked about that a couple times, but they are concerned about having symptoms of COVID, you can call 211 to be connected to a provider on the back end if you're having symptoms. And this is regardless of whether you have insurance, regardless of whether you have a primary care provider. So that is a resource if you don't have a primary care provider right now and you're concerned. Certainly if you are having acute symptoms, then you should call 911. But if you're just at home and you're concerned because you're feeling slightly ill, you can call 211.
I'm going to add on that, and because if we could have the most equitable testing site, what will be ideal would be great, not just to go get tested, but a game plan of what will happen if the test is positive, right? So that person leaves, they're tested, you grab a form and say, great, if I'm positive, I can call this number to get food delivered to my house.
Yeah.
So I can get these masks delivered, so I can do that, right?
Yep.
Make that testing kit site the model of equity. And I'm only saying that to challenge anyone, but why not? I mean, we're an amazing city with amazing talent. So I think create a site, let's work together with these fantastic individuals to create an equitable site.
Yeah, no, I agree wholeheartedly, Dr. G. Certainly for our mobile testing sites, we're looking to partner with federally qualified health centers as well as hospitals to help with providing some of those wraparound services, in some cases, case management or other care coordination services that we know people need in addition to, getting tested. I think you bring up another good point, which is the ability to isolate and quarantine if you have a positive test. And if you're living in a multi-generational household, or if you're living in, tight quarters, that may not be possible. So I do, again, I think there's always more that can be done, but I do want to commend the city who early on really did develop homeless isolation and quarantine sites to support unstably housed residents who needed isolation and quarantine. So certainly there's always more that can be done, but we recognize there's a need to provide those wraparound support services when you test positive in some cases.
Other question?
Looks like that's all we've got time for. Thank you so much.
Thank you all.
Thank you for joining us. I appreciate it. We will see each other again. Thank you. Be safe.
Thank you so much for attending the Greater Baltimore Urban League's webinar on the impacts of COVID-19 on the African American community. Please join us online on Facebook, Twitter, and Instagram at GBUL.org. We're also on the web at GBUL.org. We thank you so much for your time and attention today, and we look forward to sharing even more valuable information with you. If you have other questions, please let us know how we can continue to serve you. You can reach us at our email address, contact@gbul.org, and via our phone number, 410-523-8150. Thank you again so much for your time and attention. We hope to see you soon, and stay safe.